crowns this edition of the program.
So if you're either going to be part of the problem or part of the solution. Now you have no excuse anymore.
Through rigorous training, and today I am inducted as a member of ANA. I'm very grateful to God.
This is a journey of 2 years, and I'm so much happy that I was able to be inducted today.
They ask for so many areas in the profession, so we bring it into the job.
Forensic investigation process, sustainability reporting, and investor confidence, among others, are issues that featured prominently.
September this year. Let's keep staying safe. The Oxford AstraZeneca vaccines, Pfizer BioNTech, Moderna, as well as Johnson & Johnson.
Good morning,
The National Agency for Food Administration and Control, NAFDAC, recently gave its recommendations for the use of some of these additional vaccines in emergency. On this episode of Health Options, we evaluate Nigeria's COVID-19 vaccination efforts with the Executive Director and Chief Executive of the National Primary Healthcare Development Agency, Dr. Faisal Shaibu, as our guest. Don't miss out on these as we will be clearing some misunderstandings about the COVID-19 vaccines that could in turn change your perception about these
for the purpose of the community.
coronavirus.
Mohammed represents
in every youth. There's a
My name is Dr. Faisal Shuaib. I am the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency. Earlier today, I took my first shot of the AstraZeneca vaccine. Despite all of the delays, all of the doubts, here we are, Nigerians can finally access the vaccines. I hope that Nigerians will come out and get this vaccine because these vaccines are safe, they're effective, and they truly work. Over the course of the next few weeks, we have to continue wearing face masks, we have to do social distancing, but I know eventually once we're able to get herd immunity, then we'll be able to stop all of these non-pharmaceutical interventions. To get the vaccination, you should go to the NPHCDA website. There's a link on there that you click and you can register and schedule exactly where you want to get your vaccine.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
Thanks for staying with us on Health Options. We are evaluating Nigeria's COVID-19 vaccination efforts as the nation awaits the delivery of additional vaccines by the end of September. Let's now go over to the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib.
Nigeria and Nigerians as a whole should be very proud of the work that the federal government has done in terms of the rollout of the COVID-19 vaccines. In the beginning, we had the challenge of vaccine hesitancy, but due to the work of the media, traditional leaders, religious leaders, and then very importantly, when President Muhammadu Buhari and Vice President Osibajo came out and took the vaccine publicly, that went a very long way in making sure that Nigerians became convinced that the vaccines are safe and effective. And since March, we've had a very progressive increase in the number of people who have been vaccinated up until the time that we stopped
vaccinations right around the 5th of July. The response of Nigerians has been great. It's not where we would like to be in terms of that massive outpouring to the health facilities to accept the vaccine. This is not unrelated to the misinformation and disinformation that is going on, especially in social media. All kinds of stories about the vaccine, the fact that it is new, the fact that people don't even believe that there's COVID-19. So we're starting from a point where people don't even believe in the disease to a point where people are saying if the disease doesn't exist, then what's the vaccine for? So there's a lot of work that all of us have to do, all stakeholders have to do this piece of work around communicating very clearly about the disease, and then also the fact that there's a vaccine that is now effective to protect Nigerians against severe form of disease and death. So overall, we still have a lot of work to do with Nigerians, but then we feel that Nigerians are very rational human beings, and that once the evidence is put in front of Nigerians, Nigerians will usually take the right decision about taking the vaccine. So I would say that on the one hand, we've been able to vaccinate over 2 million Nigerians, and this is still a small fraction compared to what we want to do, but clearly the fear that people had that maybe the vaccines will expire, Nigerians will not take it, has now been debunked. Nigerians came out en masse to accept the vaccine, but we know that we need to do a whole lot more in terms of communicating to Nigerians, and we're working with the Federal Ministry of Information, the National Rotation Agency, our development partners, community-based organizations, CSOs, just to make sure that the message goes all the way to the community level, especially using the platforms of our religious and our traditional leaders.
Safety measures for disadvantaged communities are
forensic investigation process, sustainability reporting, and investor confidence, among others.
It's time for each and every one of us to realize that COVID-19 is real and it has killed millions of people around the world. Scientists have developed this vaccine. The vaccine is safe for everyone, and it contains no microchip, nor can it alter our DNA. However, we must continue to stay safe and stay clean, wear face masks, clean our hands on a regular basis, and try as much as possible to avoid a very large crowd and gathering. For those who choose to be vaccinated, it will go a long way in protecting yourself and your loved ones from COVID-19.
What sort of monitoring and evaluation have been carried out regarding the impact of the vaccination exercise so far?
Oh, we're already seeing it in Lagos, right? So with the imminent third wave, occasioned by the spike in the number of COVID-19 cases, especially in Lagos, what we're seeing from the new data that we're getting is that most of the people who have come with severe disease in Lagos are those who have not taken the vaccines, right? So most of the people who have been admitted into hospital in Lagos State are those who have not taken the vaccine, right? Even for those that took the vaccine and tested positive, you see that their symptoms are very mild, and this aligns with what we've talked about in the past, that what the COVID-19 vaccine has been proven to prevent is severe disease, hospitalization, and death, right? What we're still gathering information about is the impact of the vaccine on mild and asymptomatic disease. That is where people who may not even show the symptoms, right? We're still getting information around that in Nigeria and in fact globally. And when you sort of pivot towards what's happening in the United States, practically almost 100% of people who are dying from COVID-19 are those who have not taken the vaccines. And I hope that nobody dies from COVID-19 in Nigeria, but most likely, if anybody dies from COVID-19 in Nigeria, it is going to be among those people who have not taken the COVID-19 vaccine.
How prepared is Nigeria for the additional vaccines currently expected in terms of appropriate cold chain facilities?
Nigerians need to have multiple choices in terms of the vaccines that are available, and we're beginning to see a situation where we're not limited to just the AstraZeneca, Oxford AstraZeneca vaccine. We now have the option of the Pfizer Moderna vaccine, and that is very, very important so that especially in some of the urban areas where we can keep the ultra cold chain, these vaccines are available, these vaccines are effective, and we're getting donations from the developed countries that had hitherto shown vaccine nationalism, whereby they kept a huge proportion of the global supply of vaccines to themselves. But now we're seeing a turnaround in the way this is being managed, and courtesy of our collaboration with the COVAX and the bilateral engagement of Mr. President with some of these countries, they are beginning to release doses of vaccines to Nigeria. So, for example, we're expecting a little over 4 million, actually 4,080,000 doses of the Moderna vaccine in the next few weeks. We're just, tidying up most of the paperwork that will allow these vaccines come in. So, with the approval of NAFDAC to list Moderna for emergency use or authorization in Nigeria, that gives us the gateway to actually accept these vaccines and begin to roll out. And what we're trying to do is to now have a different model in terms of how we deliver the vaccines to Nigerians. With the first phase, we were very careful in categorizing those people who are eligible. In the first phase, we said it had to be those who were in the front line, so frontline health workers, other health workers, frontline workers, first responders, strategic leaders, and then we open it up to those people 50 years and above, especially those that have comorbidities. And one thing that we've seen is that a lot of the people that came to get the vaccines were within this category. So I'm very, very proud of the fact that Nigerians, for the most part, followed this categorization. So when we look at the numbers of people that we have vaccinated, whether it is for the first or the second dose, they fall mostly into these categories. Most of them are frontline workers, they're health workers, or those who are 50 years and above. And so far, Nigeria's performance in the vaccination rollout has been heralded by the World Health Organization as the best in Africa, right? Mm-hmm. We can only compare apples and apples, right? So within the African continent, the rollout of vaccination in Nigeria has been hailed as the best. Even when you look at the number of people that were being vaccinated every day, at some point we're hitting, almost 90,000 people being vaccinated every single day. That was a huge margin from countries such as South Africa, Ghana, who were vaccinating, under 50,000 people per day. So we have to be very proud of what the government has done, making sure that a platform such as the Presidential Steering Committee exists, the Federal Ministry of Health, the minister's leadership, the chairman of the Presidential Steering Committee, making sure that all of our trains were running at exactly when we had planned. A lot of Nigerians did not give us any chance that we'll be able to roll out a successful campaign. I know that there were members of the National Assembly too who were not very familiar with the public health sector, who said, you don't even have cold chain, you don't have health facilities, you don't have the health workers. This is not going to happen in Nigeria. And I'm glad that they called afterwards and were congratulating us for the work that we have done. We know that it took a lot of effort. We're not by any shade thinking that this is the best that we can be. Nigeria can be far better than this, right? I can imagine that with the right mobilization, with the right resources, both infrastructure and human resources, we can vaccinate as many as 500,000 people per day if we set our hearts to it. But this is where we are. Despite all of the gaps in the health sector, we've been able to mobilize Nigerians, and we've been able to, finish the vaccines. Now, it's very, very critical, to also realize that not only did we vaccinate these numbers of Nigerians, but there was a lot of fear globally and internally that because the vaccines that were given to Nigeria had a short shelf life, like some of them were like 3 months, and under, that maybe some of these vaccines will expire in our cold stores, right? But not a single vaccine expired. And guess what? If you check any health facility across the country, go to any local government, any state, there isn't a single dose of COVID-19 vaccine lying down anywhere. That means we tracked every single vaccine, every single vial until it was delivered. You can imagine if we had not been very strict, working very harmoniously with NAFDAC to make sure that we tracked every single vial. Maybe by now you will have found vaccines in the black market, right? So people have been calling me and say, look, they're looking for vaccines they cannot find. And we say, yes, that is exactly what we wanted. We don't want a situation where COVID-19 vaccines will be found in the black market, and then before you know it, you have fake vaccines, right? I know a lot of people are sort of frustrated by the fact that the vaccines are not available, but the vaccines will come, right? In the next, couple of weeks, we are confident that we will get vaccines that are donated. We're also expecting vaccines that we have also procured through the AVAT, but that is going to be coming sometime in September. But through the COVAX facility, we expect that we will get vaccines. We expect that with the next phase that will start in late July or early August, we'll be able to actually look back at what worked very well during the first phase and then what didn't work so well. So we're going to be having a workshop working with the states and our donors and development partners to do a deep dive to see how we could have done better. Yes, the health workers, the frontline leaders actually did a tremendous job, but there's always room for improvement. What are the things that we can improve on? So we're going to be doing all of that analysis ahead of the second phase, especially as it relates to communication. How can we better communicate the fact that these vaccines are safe and that they are effective, and that the Federal Ministry of Health, NAFDAC, the Presidential Steering Committee, went through a rigorous process before validating that the vaccines we're bringing to Nigeria are safe for all Nigerians. Communicating that very, very clearly is what we'll have to do before the second phase. So one thing that we did not do was to fold our arms and wait for the vaccines to come, like the vaccines that require the ultra cold chain, minus 80 degrees Celsius. We didn't fold our arms and wait until they get here or until we are offered the vaccines before we start running helter-skelter looking for ultra cold chain equipment. We knew that these vaccines were already existent. A few months ago, we got a few of the cold chain equipment because we anticipated that we were going to get a small quantity, but we knew that further down the road we're going to be requiring more ultra cold chain equipment. So what the federal government did was to engage with the manufacturers and procure 60 ultra cold chain equipment, and we're going to be we've already started the process of deploying them to the states. So up to 30, we've deployed up to 37 of this cold chain equipment across different states. A lot of the cold chain equipment will remain at national because that is where we're going to keep the vaccines. But every single state will get one ultra cold chain equipment that can store as many as 250,000 doses of the vaccine, and from there, they'll be transported directly to the local government areas and the health facilities for their utilization. So yes, we are pretty much ready for the Moderna vaccine that will be that has been donated by the U.S. government, and we hope that we'll be able to harmonize this with all of the preparations that we're making towards the second phase. A third wave may be imminent in Lagos, but I also have a lot of confidence in the abilities of our brothers and sisters.
The Sahel military
done an outstanding job
countries to defeat common enemies of peace and security in the region.
The reason why we don't have so many people dying.
The Sahel Military Games is organized,
in the hinterland.
The
third wave may be imminent, but we still have non-pharmaceutical measures that we can take, wearing of the face mask, the social distancing, our hand hygiene. If we keep up with this, I believe that it is possible for us to nip the third wave in the bud, right? We do not have the vaccines to go around the country right now. We expect that now that the developed countries are now beginning to release the vaccines, more vaccines will come to Africa and other low and middle income countries, and then we'll have adequate vaccines to go around. But we are also cognizant of the fact that Lagos is the epicenter of the epidemic in Nigeria, right? So we actually did a good analysis from an epidemiological point of view to make sure that Lagos, more than any other state, got more vaccines so that more people are protected in Lagos. So I anticipate that even if there's a third wave, it's not going to be as bad as it is feared, just because, at least more people got vaccines in Lagos, but also because we have already learned our lessons, from the outbreaks in other countries. This is why we stopped and restricted, passengers coming in from India, from Turkey, from South Africa, from Brazil, right? I think those types of interventions, provided as guidelines from the Presidential Steering Committee, went a long way in sort of slowing down the third wave, and I believe that we'll be able to curb it before it really does damage to our lives and our livelihoods.
Recently, both the President and Vice President demonstrated leadership by being among the first Nigerians to have the AstraZeneca vaccine administered to them on live TV for all in the country to see. Subsequently, many federal ministers, political leaders, and members of the Presidential COVID-19 Task Force have publicly taken the vaccine to follow in the footsteps of President Buhari and Vice President Oshibaja. To obtain it yourself, please go to the NPHCDA website. There is a link to click on in order to register and schedule your vaccination. In the meantime, please continue to wear face masks, wash your hands frequently, use hand sanitizer, and observe social distancing. This message was brought to you by the Federal Ministry of Information and Culture.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
The Sahel.
And that does it on this week's episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I remain yours, Rabi, Abdallah. Many thanks for your time. Hope to see you again.
NTA, you can't beat the rich.
Leather industry in Kano is as old as the beginning of the Hausa civilization, spanning